A 28-year-old female presents with new-onset seizures. On further examination, she has an elevated temperature, altered mental status, and a history of recent upper respiratory tract infection. Lumbar puncture reveals an elevated white blood cell count, predominantly lymphocytic, and an elevated protein level. Polymerase chain reaction, PCR, testing of the cerebrospinal fluid, CSF, is positive for herpes simplex virus, HSV. What is the most likely diagnosis in this case? A. Herpes encephalitis. B. Bacterial meningitis. C. Viral encephalitis. D. Tuberculous meningitis. The most likely diagnosis in this case of a 28-year-old female presenting with new-onset seizures, elevated temperature, altered mental status, a recent upper respiratory tract infection, an elevated white blood cell count with lymphocytic predominance and elevated protein on lumbar puncture, and positive herpes simplex virus, HSV, on polymerase chain reaction, PCR. Testing of cerebrospinal fluid, CSF, is A. Herpes encephalitis. The patient's clinical presentation, along with the findings on lumbar puncture and positive HSV PCR in the CSF, strongly suggest a diagnosis of herpes encephalitis. Here's the rationale for choosing this diagnosis. New-onset seizures with altered mental status. The presence of new-onset seizures and altered mental status is highly suggestive of an acute central nervous system, CNS, infection, such as herpes encephalitis. Elevated white blood cell count with lymphocytic predominance and elevated protein in CSF. The findings on lumbar puncture, specifically an elevated white blood cell count with lymphocytic predominance and elevated protein level, support the diagnosis of viral encephalitis, particularly herpes encephalitis. Positive HSV PCR in CSF. The positive result for HSV on PCR testing of the CSF confirms the diagnosis of herpes encephalitis. HSV is one of the most common causes of viral encephalitis. Options B, C, and D are less likely in this case. Bacterial meningitis, option B, typically presents with a different CSF profile, including predominantly neutrophilic pleocytosis, and the PCR testing would not be positive for HSV. Viral encephalitis, option C, is a broad category, and while it is possible, the specific findings in this case, including the positive HSV PCR, are more suggestive of herpes encephalitis. Tuberculous meningitis, option D, would present with a different CSF profile, including lymphocytic pleocytosis and elevated protein, but the clinical presentation and positive HSV PCR make this diagnosis less likely. In summary, based on the clinical presentation, CSF findings, and positive HSV PCR, the most likely diagnosis is herpes encephalitis. Prompt initiation of antiviral therapy is crucial in the management of this condition. In summary, based on the clinical presentation, CSF findings, and positive HSV PCR, the most likely diagnosis